Welcome to Delaware HealthCare.Reality, a podcast presentation of the Medical Society of Delaware with Dr. Nicholas Biasotto. Dr. Biasotto is board certified in family medicine, and he has extensive experience and training in treating patients with addiction and substance abuse. Now, let's join Dr. Nick Biasotto for Delaware HealthCare.Reality.
Hello, everyone. This is Nick Biasotto, host to the podcast from the Medical Society of Delaware, Delaware HealthCare.Reality. But before we start, I'd like to just do a little bit of housekeeping. A lot of people are asking, how do we access our podcast? Well, you can listen on multiple platforms. One is Apple, then we have Spotify, YouTube, Amazon, TuneIn, Alexa, iHeartRadio, Player FM, Samsung, Podchaser, and also now on SiriusXM, Pandora, and Podbean. I particularly like following it on Podbean under Delaware HealthCare.Reality. We have 6 of these podcasts that are already released and very much of interest to people. And we have one today with a guest, Dr. Stephen Kushner. Before I get to Dr. Kushner's bio, please send any questions, comments, or ideas for future podcasts to HealthCare.Reality at medsocdel.org. That's healthcare.reality at medsocdel.org. My guest today is Dr. Stephen Kushner, as mentioned earlier. Dr. Kushner got his BA degree in biology from Swarthmore College. He did his graduate work at the Philadelphia College of Osteopathic Medicine, where he received his Doctor of Osteopathic Medicine in 1988. His internship was at St. Joseph Hospital in Philadelphia, and it was a rotating internship from 1988 to 1989. Medical Center of Delaware is where he did his residency between 1989 and 1992. He's a diplomat of the Board of Family Practice. He's certified a family physician. He's also a diplomat of the American Osteopathic Board of Family Medicine, family physicians. He has received special recognition award from the Medical Society of Delaware for his obvious campaign, for which we will be talking to today. He's a Teacher of the Year at the Delaware Academy of Family Physicians. He's been a top doc for many years, including this year, 2024. He's been the president in the past of the Medical Society of Delaware from 2012 to 2013. He's been the Newcastle County Medical Society president from 2011. He was the Delaware State Osteopathic Medical Society president from 2004 to 2006. He's a chair of the educational program here at the Medical Society of Delaware. He is a member of the Government Affairs Committee of the Medical Society from 2014 to the present. He's also a member of our Board of Trustees. He's a clinical assistant professor from the Department of Family Medicine from Philadelphia College of Osteopathic Medicine. He's a fellow in the American Academy of Family Physicians and founder and moderator for annual Delaware Sports Medicine Symposium since October of 2002 and up to the present. Welcome, Steve Kushner. Hi, Dr. Kushner.
Thank you, Nick, for welcoming me today on your show and podcast. Thank you.
We have a long history, you and I.
Oh, indeed we do.
When he was a student of medicine in Philadelphia College of Osteopathic Medicine, he did a preceptor with me for a couple months. It was very interesting. I taught him a lot. I think the first lesson I taught him was learn how to play golf. I told him to learn how to play golf because golf is one of those sports in which, when you're playing it, you forget about all the problems that you've had and bothering you for days. You forget about this, you forget about that, and you just think about hitting the ball straight and hitting the ball far. So that was my first lesson. But I also taught him other lessons, such as how to do a good physical examination and try to beat the CAT scan, try to beat the MRI, try to get the diagnosis before the testing comes in. And he was an excellent student. We got along very well. I think he was referred by his father, who was a very good man that I had known for years before I even met Steve. His father was a renowned and very good physical therapist in Wilmington, and he did a lot of work in the hospitals where we worked. He was a good man, recently passed, and I give my condolences to that. I will always remember him, though, Steve. He was a good guy. Now, The topic today is an acronym, OBVIOUS, which is an acronym for things of our youth in Delaware to remember. This acronym is OBVIOUS, obvious. And the first letter implies obesity. Now, before we get into discussing all of the components of the acronym, I think this is a very important program. I talked to our executive director, Mr. Mark Thompson, and I said, this should be copyrighted and this should be circulated throughout the country. And Mark said it is already copyrighted. I did not know that, or else I would have said go right ahead and do that. I think it's a good idea. This was one of his particular platforms during his presidency. It's an acronym related to things that will help the youth of Delaware. But now that we're doing a podcast, this information will be all over the world. And I hope people pay attention to it because it's a great program. Steve, I'd like you to take over and discuss OBVIOUS from your points of view and what made you even think about it.
Well, thank you, Nick, and I can assure you that I'm hitting those balls, but they're not straight. They're going other places, but nonetheless. In my year of presidency in 2013, I thought it was important to address the issues that affect young Delawareans. So I launched this campaign for kids, It's Obvious, with that acronym standing for the 7 critical issues that affect Delaware teens, in my opinion. O being for obesity, B being for bullying, V for violence, intelligent decisions, O for opioid use, U for underage drinking, and then S for suicide. This campaign was designed to address the issues with our teenagers and foster a better communication skills, better communication between our physicians and our teenagers and our youth. And also the campaign was designed to provide a service and a resource for our community. So we reached out to both the schools and the general public with what we brought to them.
How did they accept it, and how is it being circulated?
They accepted quite well. At that time, we reached out to 7 schools, and our school health committee was able to get into these schools, and the physicians volunteered to do talks, which were quite well received.
Great.
And we also had a platform at our former building at the Medical Society of Delaware, where we had public lectures that were well attended as well on the various topics. And so we wanted to continue that, and we have continued that to the year 2024.
Great. Continue.
Let's jump in then for the first topic, which would be obesity. Now, Nick, obesity has become one of the most important health problems in the United States. And according to the Centers of Disease Control, obesity is a chronic disease that affects 1 in 5 children in the United States and 2 in 5 adults. In fact, 41.9% of adults in the United States aged 20 and over are obese. And 19.7% of children and adolescents aged 2 to 19 have obesity. And since 1980, obesity rates have tripled among children and adolescents. And in fact, a fun fact is our overweight adolescents have 70% chance of becoming overweight adults, and this increases to 80% if both parents are obese. So it really underscores how important it is for us to kind of get early to our youth, and especially with us being physicians in our practices, to kind of make this an important concern that so that going forward we can reduce the health risks that are associated with obesity.
As you know, we did a previous podcast with Dr. Shalini Shah regarding obesity, which talked about it and the health risks that it does bring. Diabetes, heart disease, hypertension, hyperlipidemia, kidney failure, liver failure. Obesity seems to be a terrible disease. We have to get that message, and you're doing a darn good job of doing it, getting the message out to our youth. Thank you very much for doing so.
Thank you. She did a fabulous job, and I would refer folks to that podcast because I enjoyed it as well. I wanted to say, how can we prevent these problems caused by obesity? Well, first and foremost, especially for the young folks, see your doctor. We get an opportunity perhaps just once a year when they're doing their physicals to come in, and if we see that their body mass indexes starting at age 2 and all the way through should be recorded in our charts, it's an opportunity for us to talk to them about exercising, starting each day with a nutritious, healthy food and continuing it through. In fact, the Delaware Division of Public Health has promoted their healthy diet 5-2-1 and almost none. And what that stands for is 5 servings of fruits and veggies each day, and 2 hours, limiting 2 hours of screen time on their computers or their games, 1 hour of physical exercise each day, and 0 or almost no sugar drinks. That includes the sodas and the sports drinks and juices. So something as simple as 5-2-1, getting that message to our youth is really critical and important for preventing obesity.
Agreed. Okay, how about bullying, the B in obvious?
Bullying, a problem much like obesity, generates national attention. Bullying is the most common form of violence. About 1 in 5 high school students report being bullied on school property, and more than 1 in 6 high school students reported being bullied electronically in the last year. Some youth are bullied more than others. In fact, 40% of the high school students who identify as lesbian, gay, or bisexual are bullied. 22% identify as heterosexual. 30% of female high schools experience bullying compared to 19% of males. In my research, I noted that the reports of bullying seems to be most in the middle schools versus the high schools, and then the primary schools. Middle schools, 28%, high schools, 16%, primary schools, 9%. And that physical bullying is also kind of patterns with cyberbullying. Similarly, the middle schools. So we really need to target our campaign to those middle school folks as well as the high schoolers and getting this message across. The children at risk of being bullied, we have to identify. Those that are perceived as weak or unable to defend themselves, those that are depressed, anxious, or have low self-esteem, those that are less popular, have few friends, and ones that are perceived as different from their peers, such as those that are overweight, are underweight, or wear glasses or different clothing. You kind of get the idea.
Yes,
These are the people, the kids that are at risk.
Well, bullying leads to many problems in children: anxiety, depression, low self-esteem, loneliness, attention problems, changes in eating habits. They eat for comfort. They get poor grades because they don't feel like they're important enough to study. Their feelings of worthlessness, and some even suicide. Boys are more frequently bullied than girls, or it was the other way around? You said it was girls more than boys, correct?
In this research that I did, it seems the girls now in 2024.
Wow. Where's social media come in here?
Cyberbullying is bullying using the use of digital technologies that can take place on social media, messaging platforms, gaming platforms, and mobile phones. It's repetitive behavior that's aimed at scarring, angering, shaming those who are targeted. And as you explained, yes, the mental effects of bullying are myriad. I have resources that we need to reach out for, and that's our message. StopBullying.gov is one that people can reach out for if they're being bullied. Bully Police USA. The CDC has an injury prevention and control youth violence website that you can go to. These are important things to get the message across to our youth.
And that 5-2-1 program, two hours on social media or on their phones, that doesn't seem to be happening. I see kids on their phones more than that. Trying to discourage them to do so is a difficult thing. Sometimes they go off and their parents are doing other things, and you have no idea where they're going on their telephones or on their computers.
Absolutely.
Okay, V is in violence. Tell me about that one.
So youth violence is the leading cause of death and non-fatal injuries in the United States. Simply put, homicide is the third leading cause of death among persons aged 10 to 24, and the majority of those homicides are from firearm violence. And in fact, in 2014, 86% of the youth homicide victims were killed with a firearm. Each day, Nick, 12 young people are victims of homicide, and an additional 1,374 are treated in emergency rooms for non-fatal physical assault-related injuries. Last Wednesday, the News Journal reported that there are incredible health and economic impacts of youth violence that are very substantial. The National Institute for Criminal Justice Reform published a national cost of gun violence last year after they studied government response to shootings in 25 cities. They found that a single gun homicide could cost more than $1.2 million. And you say, well, how can that be? Well, calculate the money spent on a crime scene, salaries for the police and the court, costs of incarceration, funeral costs, and each non-fatal shooting could cost taxpayers $700,000. Combined, gun violence could cost taxpayers $20 billion every year, not to mention the emotional costs of loss of life, grief, mental scars, trauma, fear. My message is youth violence starts early. Toddlers, for goodness sakes, can learn alternatives to aggressive behavior and violence to solve their problems. There are risk factors: child abuse, neglect, academic problems, poor supervision and management of children's behavior. There's an opportunity here, and it's early, to change those behaviors before violence patterns are established and harder to modify later in life.
Understand. I think the usage of social media is also desensitizing our children towards killing and marring and fighting, etc. That's a thing that I don't know how we can rein in, but it would sure be up to our government to try to put the brakes on some of that. Okay, intelligent decisions. That's the I and obvious.
It is. This gives me an opportunity to kind of look at topics that may be important to the youth that we want to bring a message to. Let me give you an example. Texting and driving. Teens and adults that are texting behind the wheel. You heard about DUIs? Well, this is DWI, driving while intoxicated.
Intoxicated? That's a pretty good move.
In 2024, about 400 fatal crashes occurred each year as a direct result of texting and driving. 9 Americans are killed every day due to distracted driving, and about 6 out of every 10 moderate to severe teenager car crashes or accidents are a result of distracted driving. If you stop the texts, you stop the wrecks. In Delaware, for example, in the years 2019 to 2023, there were 9,569 crashes, 174 serious injuries, and 22 fatalities. It's a scary thing. We got to stop the texting. Another topic on intelligent decisions is energy drinks. These drinks are purported to provide mental and physical stimulation. Unfortunately, they contain a large amount of sugar and caffeine, and they have negative effects on our health as opposed to being a positive effect. They can temporarily increase our heart rate, raise our blood pressure. The sales of Red Bull, Rockstar Energy, Monster Energy are in the billions. They're not very good for our health. They're actually very dangerous. So we like to point that out to the kids that we go out to the schools to.
Sure, agreed. Too bad the parents don't listen in on this too.
I hear you.
You know? Obviously, smoking's no good, but statistically, are the youth of America starting to decrease nicotine usage, or are they changing it to vaping, or what are they doing instead of smoking cigarettes? Do you know?
Well, indeed, you hit the nail on the head there. They're supplanting the smoking to the vaping, and the vaping has pretty much the same concerns that we have, especially inhalation concerns that we have with smoking. So it's really putting one with another, switching them off.
Well, the drinking and don't do drugs, that's always an important thing for intelligent decisions. So that'll lead us into the O of obvious, opioid use.
Opioid use. We're talking heroin, morphine, codeine, oxycodone, and the big player these days is fentanyl. Overall, the drug overdose deaths rose in 2019 to 2022 with 107,000 drug overdose deaths reported in 2022. The deaths involving the synthetic opioid, other than methadone, primarily fentanyl, continues to rise, and it's an alarming rise. It's referred to as the wave number 3 rise. Initially, we were kind of guilty, I believe, in the 80s, 90s, with prescription opioid medications. Doctors were prescribing them. They thought that they were safe, and quite a deal of addiction occurred in that wave where kids are getting out of their medicine cabinets, they were getting these particular drugs and medications and using them and then abusing them. Another second wave was heroin. We saw in kind of the early 2020s, heroin is on the rise, and now these non-pharmacologics, fentanyl, is surprisingly scary, and they're laced with things that are coming in and taking folks out that don't even have a chance.
Xylazine is one of them.
That's it.
With the bad results from that drug. That's a terrible drug. I think that there are some needs for chronic pain management, and parents may need something for their chronic pain, but they should sequester those medications in a place where children cannot reach them or get to them, because then they may take it, go outside, and give it to their friends, and so on.
So true. In fact, the physicians and providers have to make evidence-based decision-making processes to improve prescribing habits and patient safety. It's something that's very important.
And also tell them about keeping it away from the kids.
Absolutely.
All right, great. Now, the U in obvious is underage drinking.
Alcohol is the most commonly used and abused drug among youths, and accounts for 4,700 deaths annually. People aged 12 to 20 years of age drink 3.2% of all alcohol consumed.
12 to what?
People, young adults, 12 to 20 years of age, drink 3.2% of the alcohol consumed in the United States, and more than 90% of that alcohol is consumed in the form of binge drinking. Mm-hmm. Now, binge drinking, if you recall, it is a blood alcohol level of greater than 0.8 grams per deciliter. But in a woman, that's 4 drinks or more in a 2-hour period. And for a man, that's 5 drinks or more within a 2-hour period. And interesting, Nick, girls reportedly are drinking more than guys, 8.5% to 5%, and binge drinking as well, not just drinking alcohol, but binge drinking girls, 4% to 2.6%. University of Delaware just started its classes a couple days ago. This is something that I get to the high school seniors, and I like to do it at prom time, and if I could, right before they go to school or to college. You're going to be exposed to alcohol and parties. And binge drinking is a big issue, because if you see someone who's not conscious, who's agonal breathing, and has blue lips, you do not, as your college friend, put them in a dorm room and let them, quote, sleep it off. You need to get them to an emergency room. That is a problem. They will die.
Yeah,
and
toxicity.
We see it all the time.
Mm-hmm.
You got to get the fluids into them. You can't ignore something like that. So it's a message that we really need to create to get to them.
Great. I fully agree with you. But it's always getting it out there and making sure the parents understand this as well as the kids, because they're the ones that are going to toe the line with the children. You know what I mean?
They have to be the proper role models.
They have to be good role models.
Absolutely.
Okay, the S in obvious is suicide prevention.
Yeah, this is one that scares me the most. Over 49,000 people died of suicide in 2022. And Nick, that's one death every 11 minutes. 13.2 million people seriously thought about suicide. 3.8 million had a plan. 1.6 attempted suicide. These are CDC statistics. So that's a big problem. You've got to be able to learn the warning signs of suicide. If you're a parent, or if you're looking at a loved one, you look at whether they're having a lack of interest in activities that used to be enjoyable. Maybe they're feeling guilty, worthless, or helpless. They're having trouble falling asleep, staying asleep because of these problems, trouble concentrating, remembering, withdrawing from loved ones or friends, saying goodbye, giving away important items. These are signs that you need to be aware of. And what do you do about it? You start a conversation. Mm-hmm. You start with an expression of care. I am here. Listen to that person non-judgmentally. Normalize mental health by talking about it directly with somebody. Let them know you get it, and it's okay to be struggling with life's challenges. This year, we actually, in March, had Delaware, Sean's house. Sean's house is in memory of Sean Locke. I don't know if you're familiar with him, a University of Delaware basketball player who committed suicide. His family and friends have a house either on Main Street or close. It's a safe haven for those that are victims of bullying and of suicide, and it's just a great safe haven. And what a wonderful idea. Well, they came out at the meeting that we attended with an action plan called ALGE, and that acronym is A, assess for risk. When you're dealing with a person who's you're concerned about suicide, assess his risk, his or her risk. Listen, L, listen non-judgmentally. G would be give reassurance, never blame. You don't blame folks for the way they're feeling. E, encourage professional help. And then the final E is encourage self-help, exercise, relaxation, meditation, those kinds of things. But it's a nice little acronym to help remember or guide someone. We're not all professionals. We don't do this all the time. We may be if we're involved in behavioral health, but we want to make sure these folks get channeled to the right folks, and that's one of the ways to do it.
Well, I really appreciate and admire the fact that you're getting this out to the youth of Delaware. Okay, I'd like to take a quick break right now. We're going to talk to you about involving those parents as much as possible when we come back, Steve.
Information about the Medical Society of Delaware can be found on our website, medicalsocietyofdelaware.org. Questions about our podcast can be emailed to HealthCare.Reality at medsocdel.org. That's medsocdel.org. Once again, here's Dr. Nick Biasotto.
Okay, we're back from our break with Dr. Stephen Kushner speaking about an obvious program which he's established since his presidency in the Medical Society, and this information is now going out to the world. We have in Delaware utilized many means to get the information to parents and children in the state. We hope it is taken and run with in other states also. If anyone has any concerns and feels that their child or teenager is in danger, please call 911. If not, we have many available informative programs that you can access by going on the website for the Medical Society of Delaware, and that would be medicalsocietyofdelaware.org, and we have that information available to you. Anybody who has any questions or ideas and concerns, please email us on HealthCare.Reality at medsocdel.org.
Kind of in summary, the obvious campaign goal is to create a public awareness of these critical issues that affect our Delaware youth. Through the School Health Committee at the Medical Society of Delaware, we hope to send our physicians out to the schools in Delaware to educate and help our middle-aged and high school students address these issues. The Medical Society will continue to provide educational sessions to our community to provide resources for them. That will outreach to parents, teachers, coaches, administrators, behavioral health folks, anyone who's interested in helping our Delaware young citizens. Finally, we are having a health fair in conjunction with a 5K run on Saturday, October 5th from 8 a.m. to noon at Rockford Park. This is a family event for all ages with a theme of superheroes for health. We are all heroes if we are supporting programs that address these critical issues in our children's lives. Proceeds for will go to the Delaware Medical Education Foundation, which supports the obvious programs and keeps the momentum for change going. Thank you, Nick, for allowing me to be here today.
Steve, it's been a pleasure. You've given us a whole bevy of information, so I'm pleased you were here. You've done a nice job for us, and the program has been well received and will, I'm sure, continue to be received. Okay, any questions, comments, or ideas for future podcasts, please drop us a line at healthcare.reality at medsocdel.org.
This has been Delaware HealthCare Reality, a podcast presentation of the Medical Society of Delaware. For more information about MSD, visit our website, medicalsocietyofdelaware.org. For questions or suggestions regarding our podcast, email us at healthcare.reality@medsocdel.org. Thanks to audionautics.com for our music. Delaware HealthCare Reality is produced by Tom Minton. I'm Lori Ann Rhodes. Watch for our next podcast episode. Until then, be well. The Medical Society of Delaware, MSD, is providing this podcast for informational purposes only. It provides neither medical, legal, nor any other professional advice. The views, thoughts, and opinions expressed by the hosts or any guests are their own and do not reflect the views or policies of MSD. Unless specifically stated, reference to any specific product, service, or entity does not constitute an endorsement or recommendation by MSD. Reliance on the information provided in this podcast is exclusively at the risk of the listener. MSD expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, or other damages arising out of any individual's use of, reference to, or reliance on this podcast or the information presented in this podcast.